Good morning and good afternoon, everybody, and welcome to our webinar today, which is focusing on the Kenyan National Helmet Wearing Coalition and its role as a potential mechanism to improving motorcycle safety. My name is Sam Clark. I work for Transaid, and we've been part of this project since 2021. The project supported by the FIA Foundation and obviously all the coalition members as well. Just want to start off with a few things. We've got a series of speakers today. The, the webinar is due to take 1 hour in total, and we've allocated 15, possibly more minutes at the end for questions. Any questions we do not get the chance to answer, we will answer offline. And please, if you could keep yourselves muted, and if you could ask your questions by adding those questions into the chat box, into the chat function, that would be fantastic. One warning is that on slide 8, coming up, there is a slightly gory picture. I wanted to give you guys warning because I'm sure some people necessarily want to look at the image, but I wanted to make sure it's an impactful slide, so important we include it. But all warnings given. Stay muted, and I think we're ready to go. We'll start off with the next slide. A very quick look at the agenda for today's webinar. Really happy to say that we have a selection of founding members of the coalition to speak to you today. My opening remarks will be followed by Agi Krasnoluka from the FIA Foundation, who are the primary donor of this initiative, but also considered an implementing partner, and an important one. We'll then go through to Dr. Gladys Nyacheo from the Multimedia University of Kenya, who will talk about some of the research that we've carried out to the coalition. Our long-term colleague, Grace Wahome, representing civil society, will talk to the coalition approach, and that will be followed by presentations from government, represented by the National Transport and Safety Authority. First of all, Samuel Mwangi, who will speak to helmet quality testing, and then Samuel Masumba, who will speak to the relationship between the NTSA and the coalition going forward. I will do a quick sum up at the end before we go into questions and answers. First of all, I'd like to go to the next slide and just remind everybody who doesn't know what the core objectives of the coalition have been. We've been honoured to have been working on this project since June 2021, when we first launched the coalition. And our 4 key objectives during that time have been to set up a sustainable helmet wearing coalition with multiple stakeholders to promote collaboration in improving motorcycle safety in Kenya. We've been supporting coalition-led projects which provide scalable ideas or pilots for ways in which we can improve helmet safety in Kenya. Our focus has very much been on that 3rd objective on strengthening enforcement and domestic testing capacity. And then finally, and I think Aggie will speak to this, initiating regional dialogue and basically setting up the Safe African Helmets Initiative, which is a shared platform through which we can try to influence a Pan-African action to address helmet safety. With no further ado, I'm going to now hand over to Agi Krasnoluka from FIA Foundation. Over to you, Agi.
Thank you so much, Sam, and good morning, good afternoon, everybody. I'm Agi Krasnoluka, I'm Programs Director at the FIA Foundation, and it is my great pleasure to be joining the webinar. And I also wanted to say a heartfelt thank you to Sam and the entire team at Transaid. Also to all partners who have been working hand in hand with us, with Transaid, across the Helmet Coalition, to make helmets safe and available to everybody in Kenya. We really appreciate the effort that has everybody made to progress this issue. Uh, but yes, we're here to talk about helmets. We're here to talk about motorcycles, and we know why. Next slide, please. Because motorcycles have been dominating transport systems worldwide for a few decades now. It is estimated that the number of motorcycles in sub-Saharan Africa has increased from 5 million in 2010 to 27 million today, and could hit 50 million by the end of the decade. Next slide. So there are lots of them, but they also provide very important service. Analysis that we have done in the report Wheels of Change shows that in all these major African countries, motorcycles are used as taxi, and they provide very important mobility benefit to citizens. Next slide. Next slide. They are useful. They are cost effective relatively. They are flexible, but they are also very, very vulnerable. I think some mentioned this, but worth highlighting. In Africa, powered two-wheelers fatalities have doubled since 2013. So it's something unprecedented and something that we're not seeing in other regions. Next slide, please. And this is the gory one. This level of fatality and injury plays out in hospitals like this one in Togo. We have visited this hospital a year ago. Motorbikes account for 70% of fatalities in Togo, and frankly, this just is then reflected in the situation that we're seeing on these pictures. Hospital that looks like a war zone rather than the hospital in town. Next slide. Next one, please. And this is why motorcycles are not necessarily an issue that is very easily fit into the safe system approach. It is quite wild, it's chaotic, it's very, very difficult to manage, and that's why we appreciate through the coalition and also from the foundation that the level of effort that everybody is putting into this issue. It's difficult to manage, but of course, there are some policy steps that can be taken, and we are taking. Next one, please. And I don't think I need to tell anybody. I think we all know that the certificate motorcycle helmet is the single most effective way of reducing head injuries and fatalities. And this is where we should really start our effort with to make motorcycle riders safer with the helmet law and with the helmet standard. Next one, please. The report from the WHO, launched a couple of years ago, shows that there are many countries which still don't meet recommended policy levels in this area. And what we also find very often is that where there are standards on papers, they are in reality just lines of words. They are ignored. They are not enforced. And that's what we're seeing also on this graph here in Africa. That's unfortunate representation of this statement. Next one, please. But coalition is one of the efforts that make this change, and it can change. I'm very, very pleased and proud that as one of the achievements of coalition, we have managed to include some indicators for motorcycle helmet safety into Kenya National Road Safety Plan. It was launched 2023, right, Sam? By the President Ruto. Next one, please. A great example comes also from Rwanda, where until recently, there was no standard at all. After months of the intensive work, the Bureau of Standard and the country has launched RS 576 standard, and they are really working very, very hard to make certified helmets available to people in country. Next one, please. But requiring a standard is only the start. Countries really need to control helmet supply at the borders to eliminate entry of counterfeit helmets and to regulate domestic production. And for this, they need testing capacity to expose substandard helmets, something that we're grappling with across the entire continent, and it's a massive issue also in Kenya, with very high numbers of counterfeit helmets available on the market. Next one, please. And that's why efforts like Coalition, all the advocacy, all the work that Coalition has done to elevate the problem is really critical, because we really need to make sure that authorities understand that helmet standards are vital. And when they have means to test, when they're part of this battle, of course, they better understand also the need for supply of affordable helmets. And this is really useful, the connection between the government and the private sector. This is where they can pressurize helmet suppliers, encourage local production to helmet pricing affordable, and the quality of helmets also high. Next one, please. And once we have standards and once we have all the law in place, of course, it enables a consistent and effective helmet enforcement and training. And I know that's also a problem in many places. But we have great examples from Rwanda, where the helmet compliance is nearly 100%. So we know it is possible. And apologies, everybody. This is definitely not a picture from Rwanda. I think everybody has spotted this. I just failed to source appropriate picture. Next one, please. So addressing, I only had a few minutes, but hopefully you got the gist. And of course, you all know that helmet safety is a long-term process. Addressing issues around helmet safety is a very complex endeavor. But we believe that the coalition building is a very good framework for this, as this engages individuals, organizations, and governmental partners. And it worked well in Kenya. This is the picture from the launch a few years ago. And it feels quite emotional to look back at all this road, everything that has been done and achieved along the way. So we very much believe in country action, in national coalitions. Next one, please. But we also believe in regional collaboration and power of sharing learning and knowledge, and Sam has alluded to this in his intro. Over a year ago, we launched SAHI, Safe African Helmet Initiative, that brings together African governments committed to making safe helmets a reality in their countries, and also international agencies that are already working in this field. So the aim is to facilitate exchange, is to provide technical assistance and work together towards one goal, which ultimately is reduction in fatalities and injuries amongst motorcycle riders and passengers across the region. We work with a number of countries, and we already, considering that the initiative is fairly new, we already seen great results, like countries strengthening their standards, sourcing investment for testing capacity, improving data systems. So there is a lot that we can learn across the African region, and that's why SAHI has been conceived. If anybody has any questions, please just drop me a message on chat or contact myself or colleagues from Transaid, who of course have been with us on creating Sahi as well. I will stop here. I know there is plenty to get through, but once again, thank you for having me on this webinar, and once again, thank you for all the incredible work and progress of this project. Thank you.
Thank you, Aggie. As a coalition, I think our journey commenced with understanding the context and trying to add to the amount of research out there which specifically spoke to the Kenyan context. And with that in mind, I'd like to introduce Dr. Gladys Nicheo from the Multimedia University, who has been the lead of some of our research performed on behalf of the coalition. Over to you, Dr. Gladys.
Okay, thank you very much, Sam, and thank you, Aggie, for giving us that background that is global and local too. So my presentation focuses on what the coalition's research in Kenya has revealed. And clearly from what you're seeing, the research has revealed issues to do with the use, burden, and quality of helmets. So we know that in Kenya, motorcycles are actually a source of livelihood and a very important mode of transport. While that is true, issues surrounding it that have to do with safety have been previously discussed just based on hearsay, based on simple observations, and even sometimes rumors. So these studies by the coalition, they have helped us move the conversation from what we assume, or from assumptions, to actually evidence for stronger advocacy. So the first study that we did that was launched in March 2024 was the Fair Price report, which I have here. I really love it. And if you have, it is online, so you can always access it. Quite good, very fun, very foundational information. So for this report, we were looking at health cost of motorcycle crashes in Kenya. And this report revealed that road safety is actually not a personal problem that the riders have in terms of cost. It is a household problem, it's a public health problem, and also a socioeconomic problem that the authorities need to understand and know. Therefore, we need figures, we need evidence in order for action to take place. So this study has documented the scale and the consequences of motorcycle crashes, and also the helmet use through the observation methods that we used. We used various methods and triangulated, which gives us more strength. We also, it was evident that public transport was actually a public health problem, and also, as I've said, a socioeconomic issue. And this is a foundational study whereby we have had to build a base. It was a base for other evidence. And then after that, actually in this report, we emphasized on the need of a helmet testing lab, because the results showed that 35%, or we can say a significant number or percentage of people had head injuries. And these head injuries were quite expensive to treat. People spend so much money, so much time in hospital, and all the other community members were actually affected. So a testing lab was something that we thought would really come in handy and help. So it is from that point that the second study became even more important. Once we have shown that this is the burden, and we have shown that also there's an issue of helmet use, it is low. The next question, the next natural question would be, what do we know about the helmet rider? Or what do we know about what the helmet riders are actually using? So this study goes beyond the ownership to examine conditions of functionality. It looks at warning signs. How does the helmet look? How is the visor? How is the buckle, and etc.? And this interrogates compliance and market quality signals. So this study, which is yet to be put in public, I think it will be published soon, gives us now a view of what is there, what is in the market, what can we say about the helmets that we have? Where do they come from? Where are the pain points in terms of when you see a helmet and it has obvious, visible problems, like it has fallen and it was just used again and again and again. So this study took care of, next slide. Yes, okay, I think I've already summarized this. Okay, let me just say something about it. So this was the fair price report, and which through observations we found that 63% of the riders were actually wearing helmets, 15% of the pillion passenger were not, and that 5% of the injuries that were recorded were actually head injuries. And the key message here is that low helmet use is actually a health and livelihood problem, which I've already mentioned. And why it mattered, I've already, I think, said this. I think I went ahead of the slide because it quantifies the problem that had often been treated as just rumors or something that we just observe. And this is important for the coalition because it strengthens advocacy with evidence rather than assumptions. We can easily go to NTSA or any other government institution that deals with the safety and related and tell them, look, this is the burden we have here. What can we do about it? So that is why it matters. Next slide. Next slide. So this study is what I was trying to explain, the helmet quality study. So far, we are actually at the end of it. It should be published soon. And we had about slightly more than 1,000 respondents who are the riders. And of course, it was targeted. So you can see 99% of the riders had helmets. But just tying to the other report, the fair price report, where 15% of the users of the pillion passengers were using helmets, then you can see here it actually ties. I have already mentioned about the obvious physical appearance of the helmets. And here in my slide, the blue box, we are talking about strengthening the quality argument. So in this study, the helmets did not display the year of manufacturing. They also did not display the logos. Most of them were missing logos, and none of the helmets identified with the new one that is coming in, the UNEC 22.06. And this study now creates a baseline for future quality monitoring. Next slide. Should be my final slide, I hope. So just to put it together, I would say that both these studies have a clear message that this burden that we have is on the burden in terms of cost, the use, because there is low use, and also the quality, because we cannot assume that the helmets that are being used are actually quality. We need to go in and check. And this strengthens our need for a helmet testing lab. Yesterday in a discussion that we had, there was the issue that from Rwanda, they said that some of the helmets that were coming in were not passing the test. Even the manufacturers had to come to the country and check what was the problem. So this makes it very important for us to have a testing lab. And all this because we are able to give evidence that supports what we are saying and what we are seeing. And this all supports the National Road Safety Policy and the country at large in dealing with the safety issue, because motorcycles are here with us to stay and they are very important. We need to protect our people, and evidence through research is going to do it for us in a big way. So thank you very much. I think just move to the next slide, and then I invite Grace to continue with this conversation. Thank you.
Thank you, Gladys. My name is Grace Wahome, founder member of the coalition, which was formed in 2021. It was formed as a multi-sectoral body, and this came with the background knowledge of the fact that many stakeholders in this sector were working in silos: the government, the civil society, the private sector, the riders themselves, academia. And so there was replication of efforts, and hence the need of one body that will bring everyone together on the table so that we do not replicate efforts and we speak in one voice. And so in 2021, the coalition was formed. And the coalition works hand in hand with the government, not against the government. And when the coalition was formed, it emphasized the need to work with rider members so that we can have them in the group and they can be able to tell us the issues they have and why they're not wearing helmets. And we were able to also educate them on the need for wearing these helmets. It is important to also state that the coalition works with riders in circles, and the reason being there is self-regulation in circles. And once the riders were able to understand the need for wearing these helmets, like my colleague Gladys was talking about the fair price, they were able to see the cost implication when it talks about health, not just to themselves, but also to their family members. And there was a shift. And this helped educate them better. And this way, when we work with SACCOs, like most of us know in Kenya, this is the place where you bring your savings together as a group. Now, the riders saw the need of not having these monies sort out accidents or injuries that have been caused when they were riding, but to be able to develop themselves. We have seen a good case study with our riders in Kibra. They've been able to buy land, they've been able to advance themselves, and hence they're able to police their own members. Why are you not wearing a helmet? Why are you riding recklessly? And it's no longer the job of enforcers, so to say, but they are able to police themselves. This helps when we are talking about sustainability, when it comes to safety issues. The coalition is very, very keen on working with the private sector. We are cognizant of the benefits that the private sector brings in the boda sector, and also they would benefit from it. And hence we've been calling upon the private sector to come in, and we are seeing a good change, though we would want a better outcome in the future, where the private sector is also pushing the road safety agenda, even as we move forward. I can say that there's been a lot of work for helmet sensitization, even as my colleague was talking, Gladys, the studies that we have done, and we can say there's an issue. Let me go back a bit and say that having the traffic police in our midst has been great, because we were able to look at the tool that collects data of crash incidents. And we noticed that there was a gap when we are talking about riders who are wearing helmets and those who are not wearing helmets. Yes, these incidences would be recorded, but there would be no indicator to show whether the rider was wearing a helmet or his pillion passenger was wearing one or not. That gap was filled when we revised that tool, and we get updates every day. As of today morning at 4 a.m., we received data that there were 4 serious injuries today of riders and pillion passengers who were not wearing helmets, and 2 fatalities, 2 serious injuries. That was as of 4 a.m. this morning. We are going to get another report at 6 p.m. that will look at what has been happening the whole of this afternoon. So we are able to analyze that data every month. And there's been a gap, a very huge gap, even with the work that we are doing of sensitization. My colleague has said the kind of work that we are doing. One of the things that I would like to mention is the work we did in Mombasa and in Kibra, in Nairobi, where we were sensitizing riders on helmet wearing. Our riders have gone on radio, on TV to talk about the same. Yet we still see a gap of those wearing helmets and those not wearing helmets. And we've also seen the wearing of a helmet shifts outcome when you look at the analysis. A serious injury for one who is not wearing helmets easily comes to a fatality. Yet for those who are not wearing a helmet, but for those wearing helmets, the outcome shifts from serious to non-serious. So there is need for wearing helmet. But let me say this, with all the work that we have put in, we have seen that the gap between the outcomes, the shift of outcomes has not been very big. And this has begged the question, well then, are our helmets not safe? Are our helmets not quality? My colleague has said there's a report coming out soon that will also show the same. The lack of quality has made that gap very small. If the quality of the helmet is looked at, we can definitely say, without a shadow of a doubt, because of the data that we have collected, that the gap will be bigger, that there will be a big change that we will be seeing between riders who wore helmets and those not wearing helmets, and the impact in terms of the injury. And with that, we work hand in hand with the government to make sure that we have an established testing lab for the helmets. And that is part of what we have been doing for the last 3 years, pushing for this agenda. And we can confidently say that these efforts are yielding fruit. And my colleague Sam shall be able to tell us more from a government perspective as to where we are at with that and where we are going. Thank you very much. Sam, over to you.
Okay, thank you. So good afternoon, also good morning. So allow me to first begin by appreciating organizers for this webinar and also the Helmet Coalition for convening this important discussion on helmet safety. So my name is Samuel Mwangi. I'm an officer under the Directorate of Road Safety, that is NTSA. And of course, I would also like to acknowledge that is my previous speakers, that is Sam from Transaid, Haji from FIA, Dr. Gradis from Multimedia University, and also Grace from the Helmet Coalition for the insightful presentation and also for the study findings that Dr. Gradis was able to share. And of course, the evidence that has been provided, of course, is very variable because it helps us first start to understand the current gaps that we have in terms of the helmet quality, the usage, and also in terms of compliance, that is the riders wearing the helmets in Kenya. And also, it also provides us with a strong foundation for informed policy and enforcement action. So basically, from where we stand, Kenya basically lacks a fully equipped and accredited helmet testing laboratory, which of course is a bit of an institutional gap that constrains the country's ability to enforce the issue of that is helmet standards, the issue of helmet quality, and also protect the motorcycle riders and pillion passengers. And of course, what you notice it is that it is from this deficiency that necessitated a technical mission to be run, which was aimed at benchmarking against the globally compliant testing facility and post-drawing practical lessons. And of course, what we focused on is that the insights gained from this visit would actually provide a clear pathway that would ensure actually reform the issues of that is informing the industry. Then, of course, focusing on investment, and of course, underscoring the urgent need to actually establish a domestic helmet testing laboratory here in Kenya. And of course, apart from establishing a helmet lab in Kenya, she also underscored the importance of building capacity, that is specialist capacity, and also operationalizing the credible certification and accreditation systems, that is for the manufacturers of those helmets. And of course, one of the things that came out is that addressing this gap is not just a technical upgrade, but of course, it's actually a life-saving intervention that is aligned to the National Safety Action Plan, that is 2024 to 2028, and very essential to reducing fatalities among vulnerable road users. So, next slide. Yeah, so basically, what you notice is, like I've mentioned, this initiative is aligned to the National Safety Action Plan. And of course, the focus area here was on protection of vulnerable road users. And of course, in this case, the motorcycle riders and the period passengers. Next slide. Yes, so the engagement was very deliberate. And of course, what we are looking at is ensuring that we meet with the industry leaders, especially in the helmet industry. And of course, with the globally recognized experts. And one of the things that we were able to do is that we were able to actually visit Newton Labs, which is actually a globally recognized helmet testing facility in Italy. And we were able to conduct this visit, that is on 27th January 2026, this calendar year. And we had that is a privilege of being joined by a team from KEBS, that is Zakaria Rukorito. We also had Ben Pochin. We also had Samuel Karaja from NTSA, that is under the Standards Implementation Department, which is housed under the Vehicle Inspection and Safety Programs Directorate. And we also had, that is I from the Road Safety Directorate. We also had Dorcas Wagira, who is an independent journalist. And of course, I know she has done a piece on the same. We also had Kate Turner from FIA Foundation. We also had Oliver from FIA Foundation, and we also had Sam Crack and also Terry. So the primary objective of visiting this helmet lab was to basically observe a fully functional, internationally accredited helmet testing laboratory. And the other objective was to basically witness a live testing of the Kenyan helmets against that is KES 77, the ECE 2205, and of course the ECE 22, that is 06. And of course, what you notice here is that during that visit, we were able to carry sample helmets that were sourced from the Kenyan market. And of course, these are the helmets that we actually subjected to this test, that is against the KES 77, the ECE 2205, and also the ECE 2206 standard. And of course, the other issue is that we wanted to gain the first-hand exposure to best practice in testing, certification, and quality assurance. And of course, these areas are very critical. And of course, as we continue as a country to strengthen our helmet safety framework. So during this visit, we were able to observe key tests that the helmets underwent through to ensure that they provide adequate protection to them in the event of a crash. And of course, what we notice is that when you talk about these three standards, one of the things that came out clearly is that for the Newton Labs, they are actually accredited to actually conduct the three tests. That is the KES 77, the ECE 2205, and also the ECE 2206. So when it comes to the tests, there are there are 5 categories of tests that are performed. That is across board for all helmets. And the key test categories are 1, the helmet stability test. We also have the retention system strength test. And we also have the helmet impact testing, the helmet rigidity test, and also the optical test. So basically, these are tests that are conducted across board. But of course, in our case, with the Kenyan samples that we carried, we took to test, we were not able to conduct all the tests, but I can confidently say that we were able to conduct the helmet stability test. We were also able to conduct the retention system strength test, and we were also able to conduct the helmet impact testing and also the helmet rigidity test. The only test that we were not able to conduct was the optical test. Next slide, please. Yes, so when you talk about the helmet stability test, this was the first test that we were able to conduct. And the objective of this test is to basically check whether the helmet can remain stable, that is on the rider's head, and not roll off in case that rider is involved in a crash. So what happens in this case is that in this helmet lab, they have headphones. And of course, these headphones are actually designed based on the demographics of the specific countries that the helmets are going to. So in this case, when you talk about the helmet lab that is in Milan, most of the headphones are actually headphones that were designed with a specific attention to that population in Italy. So what you notice is that if in this case we want to have or actually have a helmet testing lab in Kenya, we would actually have to do a research and actually come up with headphones that more or less copy how the human headphone or the Kenyan headphone is actually, how it looks. That is how our heads look, if you allow me to use that simple word. So basically what happened is that a hook and a strap assembly is basically attached to the rear of the helmet in order to try to put the helmet up and over the head. So in this case, once the test is done and the helmet stays on the headphone, then of course that is actually a pass. But of course, when we talk about this pass, it is measured again in relation to the angle in which it tilts away, away from the head. And of course, this varies based on the different standards. So what you notice is that the standards that have been put in place for the KS77 are different from the standards that have been put in place for the ECE 2205, and also different from the standards that have been put in place for the ECE 2206. But at the end of the day, it is very critical that the helmet stays on the headphone, because that means that in the event of a crash, then that helmet is able to protect the rider. And of course, once the helmet is able to stay on the headphone, that indicates that even when it comes to the placement of the chin strap or the retention system, it means that the geometric placement is actually correct, and that is why the helmet is able to hold on and actually stay on the headphone. The other type of test, so you can go to the next slide. Yes, so there you can be able to see some visual representation of some of the photos that we took when the helmet stability test was being conducted. And of course, the other type of test, go to the next slide there, please. The other type of test that was able to be conducted was the retention system strength test, which basically assesses the strength and the reliability of the chin strap. And of course, a helmet in this case is only effective if it remains securely fastened during an accident or a crash around this case. So in this case, the objective here is to measure the structural integrity of the helmet's retention system or the chin strap. And of course, what happens here is that the helmet is put in a machine. And of course, the machine is able to apply pressure to the strap itself. And of course, based on the specific standards that are being tested, there is some specifications that have been put in place. But one of the things that we were able to deduce is that when it comes to the retention system strength test, one of the key factors is that there is a time limit of 2 minutes. And of course, when it comes to the chin strap elongating, under pressure, the chin strap should not elongate for more than 25. That is millimeters. And of course, during the testing itself, when it comes to the dynamic elongation, the strap is not also supposed to exceed that 5 millimeters. And of course, even upon the test ending and the weights being removed, then the elongation in sheath itself should not exceed the set 25 millimeters. Then, so we can go to the next slide. Yes, so you can see the graphical representation there. And of course, in the first photo, you are able to see that is the machine that is being used for, that is for the retention system strength test. And of course, in this section, this is the machine that is able to test, that is against the KS77. And also, we have another machine that is also able to test against the ECE 22, that is 05 and 2206. And of course, what you notice is that in the first test, the pressure, the helmet is placed on a head foam, which is placed on that is on a flat surface, and then the chin strap is now a pressure is applied on the chin strap, and of course, in the other test, that is for the EC 2205 and 2206, instead of the helmet being placed, that is on the head foam, and then on a flat surface and pressure being applied on the chin strap, what happens in that case is that the helmet is actually drilled on the top, that is on the top, and of course pressure, then pressure, once the helmet is put on a head foam with that central point, at that central point, then pressure is applied. And of course, we also have another test that we're able to conduct, that is the helmet impact testing. And of course, the helmet impact testing basically evaluates the helmet's ability to absorb shock when the subject, that is when there is a collision. And of course, this is very critical in reducing the force transmitted to the rider's head. And of course, basically, there are 4 types of tests that are performed in this case. And of course, we have the chin bar test. And of course, this happens for the full face helmets. Then we have the front tests. We also have the side tests. And also we have the rear impact test. And we also have the crown, that is on the top test. And of course, what happens here is that a helmet, there is a force is applied, that is to the helmet, based on the standard. Of course, the force can be applied at the chin bar, on the front side of the helmet, on the side of the helmet, on the rear of the helmet, on the top of the helmet. And of course, when it comes to also the issue of the other test, then the helmet is also actually released from a certain point. And of course, it falls on a platform that mimics a rider falling either on a pavement or a rider falling on a flat surface that is on the tarmac. Apart from that, we also did another test, that is the helmet rigidity test. And this test basically evaluates how well a helmet can withstand compressive forces without excessive deformation. And of course, one of the key factors here is that the helmet should not collapse. And in that case, the helmet should not also transfer a lot of force to the skull. And also, the helmet should maintain its protective shape. So, this test basically involves lateral and longitudinal compression of the helmet against 2 plates. And of course, there is always a limit in terms of the deformation that should happen. And the deformation that you're able to see there on the screen, that is 630 newtons, is because when you talk about that is a force beyond that, ultimately, if a rider experiences a force beyond 630 newtons, then that force is enough to actually cause internal serious injuries to the head. So the minimum that is set is at 630 newtons. And of course, the rigidity tests in this case for all the standards are actually the same. Then we also have the other test, that is the optical test, which unfortunately we were not able to conduct. But of course, it's actually a key requirement in all the standards, that is the AS77 and also the ECE 2205 and also the EC 2206. And of course, the objective of the optical test itself is to check how well a helmet visor or the face shield allows a rider to see clearly and safely. And of course, when we mention about seeing clearly and safely, that comes even to the issue of when it comes to the issue of the visor should not actually even, that is limit the ability of the rider to distinguish the different colors, so that if it's a traffic stop, then that helmet should actually allow the rider to differentiate between the green, that is the green, that is the go, and also the stop, that is the red sign, and also the other. So it should not interfere with that. And of course, there are other tests that are able to be conducted in relation to that, including that is the likelihood of the visor or the face shield protecting a rider from sharp objects when the rider is actually riding. So one of the most important aspects of the visit was actually witnessing the testing of the Kenyan helmets. And of course, what I can say is that what we observed was a bit quite revealing, because there was noticeable variability in the quality and performance of helmets available in the market that we were able to carry for testing. And of course, in this case, when they were being tested against the three standards, that is the AS77, the AC 2205, and also the AC 2206. And of course, the variability meant that some helmets passed some tests, while other helmets failed other tests. And of course, overall, go to the next, yes. So overall, the Milan visit significantly improved our technical understanding of the helmet testing systems, and also helped bridge a very critical data and knowledge gap. And of course, one of the things that I can say, and of course the team that was there can attest to, is that it provided us with practical insights that of course will inform going forward the issue of policy development, the issue of regulatory enforcement, and also the issue of strategic investment in helmet safety. Importantly, one of the things that we were able to take home is that there is an urgent need for Kenya to basically establish a domestic helmet testing capacity in Kenya. So that's it from my end. Asante.
Thank you, Samuel. That was a really informative, very detailed presentation of the helmet testing in Milan. If we could go to the next slide, please, that would be great. So just going to summarize so we can dive into some questions. Progress in Kenya, just to summarize, we have a strong coalition in place with over 70 organizations and agencies represented on that coalition. We've implemented a series of scalable projects which have been coalition-led, which present sort of examples of ways to replicate support to improving research gaps, building capacity around enforcement. We've developed 5 short films around raising awarenesses, targeting the riders specifically. We've also trained 100 peer educators, which are riders who are trained and sensitized to pass the message on around helmet safety. And we've also implemented an affordable helmet initiative, which looked at the role that THACOs or rider cooperatives can play in directly linking with manufacturers to access helmets and providing flexible payment systems for the riders themselves to promote affordability. Obviously, advocacy has been a crucial part of the coalition over the last few years. We like to think we had some sort of say in the fact that the National Road Safety Action Plan, launched in 2024, has as a target the establishment of a helmet testing lab in Kenya by 2028. We're confident, and speaking to NTSA and KEBS about this, in identifying a potential donor for that helmet testing lab equipment. And the second study, the helmet quality study that Dr. Gladys was talking about, can act as a guideline, act as a baseline against which we can measure progress in terms of the amount of substandard, non-compliant helmets which are out there on Kenya's streets being used by riders. Next slide, please. So in effect, as Transaid steps back from this project, coalition next steps, obviously the NTSA's role is going to be crucial in continuing to build the strong Kenyan coalition, and NTSA have agreed to administer and host the coalition for the foreseeable future, which we're very grateful for. There are, and I think Kenya Bureau of Standards would be open and honest in admitting this, some shortfalls identified in terms of testing capacity, which we'd love to support as a coalition to overcome those challenges. We need to continue engaging with the private sector, particularly retailers, importers, employers, people supplying helmets to the riders to ensure compliance with the helmet standard. Strengthen market surveillance capacity, which is a role most usually performed by the Kenya Bureau of Standards. And it's the coalition's objective to support the government to commence the procurement of the testing lab equipment very soon. We'll then measure the impact of the success of that initiative once the testing lab is in operation. And of course, we don't want to forget the regional initiative. Kenya has a lot to learn from other countries, but other countries also have a lot to learn from the way that Kenya has decided to address motorcycle safety in the country. And I'm sure, and I think I can speak for the Kenyan group on here, they plan to continue engaging with the Safe African Helmets Initiative. If we could go to the next slide, I think we're going to open up to a few questions before we switch off for today. Any additional questions, keep them coming because we can answer them offline. But I've got a few questions here that I'd like to share with the presenters. First one to you, Dr. Gladys. Have you identified any other research gaps, or has the coalition identified any other research gaps which you're looking into that would contribute to improved motorcycle safety?
Okay, thank you, Sam. I think a consistent issue that appeared in the first report, the first study, Fair Price report, and this study that has just been concluded is the issue of passenger helmet use. That's a gap that has appeared in both papers. And for the second study, it presents as riders not having helmets for the pillion passengers. And the first one, we could actually observe that pillion passengers were not using helmets. So I think that is one of the areas that probably we need to get into. We've had a bit about it, but probably we need to get into it even better. Another issue that maybe we can look at is the research that supports implementation. I had a discussion with Grace some other time, and we were wondering that we were talking about what else can we do. So I think from my side, we can think of research that supports implementation, so that this evidence that we get can actually be feed directly into the targeted advocacy. And one thing that is close to my heart too, that I think I found through all these studies, is children and motorcycles. In our first study, we realized that there were pillion passengers that were children that were affected by motorcycle crashes, but there's not much research around that area, and especially now that we use motorcycles to school a lot. So thank you very much. That's what I would say.
Thank you, Dr. Gladys. My next question, coming through from various different platforms at the moment, is to you, Grace, actually. People are asking, a couple of people have asked, how can we join the coalition and how do we engage? What are the ways in which people can engage with the coalition?
Thank you, Sam. The coalition was basically designed to be very inclusive and multi-sectoral. And at its core, it welcomes any institution that is committed to reducing motorcycle-related injuries and deaths through increased helmet use. And yes, as much as we have a structured way of joining the coalition, it is very accessible. Once you express your interests, we want to know who are you, what do you do, does your work align with helmet safety, and does your work align with the boda sector? Then we are able to share also our objectives, our goals, and where we want to be as a coalition. And if those align with you as well, then we endorse you. We put the names forward in our coalition meetings, and the group endorses you, and you're able to become a member. Yes.
Thank you very much, Grace. Very clear. And of course, the coalition has a WhatsApp group, which Grace, I think, is the administrator for that WhatsApp group. So there's lots of chat that appears on there. So please do feel free to join at any time. Just a couple of questions in the chat at the moment. Carmen, you will be absolutely amongst the first to receive that report on the helmet quality, and there's a detailed methodology section around what indicators we use. So we will share that with you within the next couple of weeks. Patrick, thank you from the Global Alliance of NGOs for Road Safety. We know that our voices together are stronger, and we appreciate your willingness to join forces and strengthen that message. My last question, and I'm going to ask Aggie to be very brief on this, if that's okay, Aggie. But I wonder if you could elaborate slightly on the Safe African Helmets initiatives. Who's involved? What exactly is it? Yeah, if you could just elaborate slightly on that, or where people can get more information as well.
It's going to be very quick, Sam. Thank you. Joking. Good question. I was quite vague in my introduction to SAHI during the presentation. So we have at the moment a number of countries that are members of SAHI. So this is Kenya, Rwanda, Uganda, Ethiopia, Tanzania, Benin, Senegal, and Cameroon. The structure that we are utilizing through SAHI is that direct collaboration with government or Bureau of Standard within each of the countries. So there is this opportunity for very specific and very targeted technical dialogue and technical assistance to countries that are really keen and really active in undertaking the helmet safety policy. As a second layer in SAHI is the collaboration with international development agencies. We've got some of our partners here. We've got GRSP, we've got Global Alliance, potentially someone else. I'm sorry, I won't scroll down the list of participants, but these are organizations that are also very, very engaged in the movement towards improving helmet safety. And we just want to make sure that there is a strong collaboration between all organizations that work within this sphere, so we can add value to each other works rather than work in parallel, or perhaps sometimes that it happens, not even know about fact that someone is working within the same field. So, as an example, Patrick mentioned the excellent white paper of Global Alliance. So we want to make sure that we will also participate in dissemination of the study, or look at gaps that we can then jointly fulfill in the research done together at the later stage with colleagues from GRSP who deliver excellent and incredible work focused on technicalities of helmet safety in number of countries, which are our priority countries as well. We want to make sure that if there are any areas that their work would not cover, we can come in and offer support and some technical help. So this sort of thing, just Sam, just to make sure that there is a proper mechanism that for the collaboration across the countries and across the partners, that's sort of underpinning idea for SAHI.
Thank you very much, Shaggy. Thanks for being brief on that one. Thank you, everybody. There's a QR code here, which if you go through that takes you to the Knowledge Center where you can access some of these reports. I also shared the link to the Fair Price report earlier in the chat box if anybody's interested. And then very quickly, last answer to a last question from Aline, who's asking which standard are you going to use for the test lab. We're going to use whatever standard is nationally aligned to the national standard in Kenya, which currently has moved from KS77, which was a unique national standard to Kenya, closely aligned with the Indian standard. But the more recently they've gazetted the UN 2205 in Kenya. The actual ambition with the testing lab is to test to more than one standard going forward. I hope that answers your question. I'd like to thank all the speakers today for their efforts, their contributions, and I'd like to thank the audience as well for your patience. I know we've run slightly over time. Any future questions, any other questions we haven't answered, we shall be in touch. And everybody that registered should be receiving a link back to the recording of this webinar. Thank you very much, everybody, and have a great rest of the day.